Hello everyone. Today we'll be talking about the radius. The radius is the lateral bone of our forearm and is homologous with the tibia of the lower limb. It has an upper end, a shaft, and the lower end which is broad. And the most prominent part of the lower end is the styloid process. Now side determination. How will you determine the side? So the upper end is having a disc-shaped head, a narrow neck, while the lower end is expanded and with a styloid process. Close to the neck in the upper end is the radial tuberosity. This is the radial tuberosity. At the lower end, the anterior surface, the anterior surface is a form of a thick prominent ridge, while the posterior surface present with grooves for the extensor tendons. So this is the anterior surface with a concave area, this one, and the inferior surface, as you can see, is with a ridge and spaces for the tendons. These are the extensor tendons that are lodged here. The lower end presents a tubercle on the posterior surface. This is the most prominent tubercle. Now this is the sharpest border. This sharpest border is towards the medial side. That is known as the interosseous surface or interosseous border. So this particular bone, as you can see, if this is the anterior surface, concave surface, and this is the grooved posterior surface, and this is the medial surface, so it will be, and if this radius is lateral bone, so the radius is the radius of the left hand. This is my left hand, so this is the radius of the left hand. Now parts and features. First, the upper end, as you can see, it is rounded and it is covered with hyaline cartilage in the living and has a superior concave surface which articulates with the capitulum of the humerus. For humerus, you can go to my video where I have explained the complete details of humerus. This forms the elbow joint, and the circumference of the head is also articular. It fits into a socket formed by the radial notch of the ulna and the annular ligament, thus forming the superior radio-ulnar joint. Cut. Next, the neck is enclosed by the narrow lower margin of the annular ligament, and the head and neck are free from the capsular ligament and can rotate freely with the socket. Now the radial tuberosity lies just below the medial part of the neck, and it has a rough posterior part and a smooth anterior part. Now coming to the shaft has three borders and three surfaces. This is the anterior border, which extends from the anterior margin of the radial tuberosity. This is the anterior border. It is oblique in the upper part of the shaft and vertical in the lower part. This anterior border ends at the styloid process of the lower end. Now the posterior border is the same as the anterior border, but in the upper end there is the posterior oblique line. The medial or the interosseous border is the sharpest and the most prominent border, and it extends from the radial tuberosity above to the posterior margin of the ulnar notch below. The interosseous membrane is attached to the lower 3/4 of the border, and is lower part forms the posterior margin of the elongated triangular area. So these are the borders. Now coming to the surfaces. Now the anterior surfaces between the interosseous border and the anterior border, the most prominent thing is the nutrient foramen. You can see this is the nutrient foramen present in the anterior surface. This nutrient foramen is usually projected upward, that is, the growing end will be the opposite side, this is the lower end. Now coming to the posterior surface, between the posterior and the interosseous border, the lateral surface lies between the anterior and the posterior border, shows a roughened area in its middle part. Now coming to the lower end. Coming to the lower end, the lower end is the widest part of the bone and has 5 surfaces. Now the anterior surface, which forms a thick prominent ridge, the radial artery is palpated over this area against this surface. The posterior surface has grooves, 4 grooves from the extensor. For the extensor tendons, the dorsal tubercle of Lister lies lateral to the oblique groove. This is the oblique groove and this lies lateral to this. The medial surface has a notch. The medial surface has a notch for the head of the ulna. The lateral surface is prolonged downwards, which forms the styloid process. Now the inferior surface. The inferior surface, as you can see, has a lateral. The inferior surface has a lateral and a medial articular surface. Lateral one is the triangular and the medial one is somewhat rectangular. So this surface takes part in forming the wrist joint. The triangular area is for the articulation with the scaphoid bone, and the medial triangular area is for the lunate bone. This is a bit triangular in shape. Cut again. This is the inferior surface. The inferior surface bears a triangular area for the scaphoid bone. This is the triangular area which is lateral, and a medial quadrangular area for the lunate bone. This surface takes part in the formation of the wrist joint. This is the medial quadrangular area, and this is the lateral triangular area. So coming to the attachments, the biceps brachii is inserted into the rough posterior part of the radial tuberosity. The anterior part of the radial tuberosity is covered by a bursa. The supinator muscle is inserted into the upper part of the lateral surface. The pointer trace is inserted into the middle of the lateral surface, and the brachioradialis is inserted into the lower part of the lateral surface just above the styloid process. Okay. Now the radial head of the flexor digitorum superficialis takes origin from the anterior oblique line and the upper part of the anterior border. The flexor pollicis longus takes origin from the upper 2/3 of the anterior surface, and the prolnator quadratus is inserted into the lower part of the anterior surface into the triangular area on the medial side of the lower end. The radial artery is palpated for the radial pulse on this side, as it lies on the prolnator quadratus, medial to the sharp anterior border of the radius, lateral to the tendon of flexor carpi radialis. Okay. Now next, the adductor pollicis longus and the extensor pollicis brevis arise from the posterior surface, and the quadrangular ligament is attached to the medial part of the neck. Okay. The interosseous membrane is attached in the lower 3/4 of the interosseous. Hello everyone. So today's topic of discussion is radius, and as you know that radius is the lateral bone of the forearm, and it is homologous with the tibia of the lower limb. It has 3 parts: the upper end, shaft, and lower end. The upper end is characterized by a head which is circular, almost circular, Now side determination, the upper end will be having the disc shaped head, and the lower end will be having a broad area, and it is the lower end has a prominent end that is known as the styloid process. In side determination, the anterior surface will be smooth and there will be a triangular area over the lower end, and posterior surface is characterized by a prominent tubercle, the dorsal tubercle of Laskar. The upper end is having the head which is disc shaped and is covered by hyaline cartilage in the living. The circumference give attachment to the annular ligaments. Attachments, we have biceps brachii which is attached over the posterior of part of the radial tuberosity, the supinator muscle which is inserted in the upper part of the lateral surface, the pointer teres inserted in the middle of the lateral surface, and the brachioradialis is inserted in the lower part of the lateral surface just above the styloid process. The radial head of the flexor digitorum superficialis takes origin from the oblique line and the upper part of the anterior border. The flexor pollicis longus takes origin from the upper 2/3 of the anterior surface, and the pointer quadratus is inserted in the lower part of the anterior surface into a triangular area on the medial side of the lower end. The radial artery is palpated for pulse over this radial over this triangular area. So this were the parts and the few attachments. Just to revise, this is the upper end, this is the lower end, and this is the radial tuberosity where the biceps brachii muscle is attached, and this is the head, this is the neck, this is the shaft, and this is the medial border which is very prominent and sharp. The lower end has this tubercle known as the dorsal tubercle of Laskar, which is posteriorly placed, and the styloid process which is laterally. So this is the left lateral bone. This is the radius, and we'll be talking about ulna in the next video. You can see this, the ulnar tubercle, how it articulates and forms the lower end. And the upper end articulates the radial tuberosity in the ulna. In supination and pronation. So this is the radius. Thank you for watching. This is video after a long time, and I really want to make more videos. To do suggest for any topic or particular thing that you like or dislike. Thank you.